A question here about the health care bill. I heard over 125 commissions, boards, and departments at the federal level have been created through this bill. Finally, it looks like the federal government is getting involved in job creation. Under which federal department are these hirings going to, and at what cost?
Yeah, well, there is a large cost, and there are a number of commissions. It's 100 and some commissions that will be created. And that's where the rulemaking procedure kicks in. That's where I think a lot of patients and physicians are concerned about freedom being taken away from that doctor-patient relationship, to be honest, in the creation of a lot of these commissions, because the government will have yet to define what is considered adequate minimal coverage. And that'll be defined more down the road. And if you don't have that adequate minimal coverage, that's where your company is going to get fined an additional level, to the point now where the IRS will have the ability to fine you up to, I think it's up to 2% of your gross income. And they're going to have IRS agents hired as a part of the auditing procedure as well, because now the government is not just a collecting of revenues, but there's going to be sort of a check and balance on what's taking place on mandated health care. And that's, I think, why some states have expressed the concern about, the individual mandate. Is that right? Is it wrong? And the federal government's overreach. And so these boards and commissions ultimately end up with a lot of power. And we see that in the medical device community right now, that quite honestly is strong in Minnesota with 20,000 some jobs. And it's not just Boston Scientific, Medtronic, some of our larger companies that we all know by name. There are so many small companies around here that are coming up with the next peace of mind solution for patient care or life-saving technologies. And I was at one company last week, 13 employees, and they've got 45 days left of cash to run their operation, and they've been dragged through the mud from the FDA to get approval on a certain product they're offering. And every time they come back and they answer their questions they get asked by the FDA, they get dragged back with, well, now we need an answer to this. So the bureaucracy is really making it difficult for some of these companies to move forward. And I think with these commissions, we're going to see the same thing happen.
Here's a question that goes back to the reference to the value-add tax that has been thrown around that you referenced earlier. And the question is whether or not the value-add tax would be in place of the federal income tax and other taxes, or if it would be additive, and then how that, if you have any information on how that would compare to other countries that have a value-add tax.
Well, I don't think it would be, the value-added tax would not be to replace. I don't think the conversation is about that right now, because, whether it's the folks that are involved in creating a new deficit commission out of the administration or otherwise, I think they want to get some sort of a tax increase on the table on a broader perspective. And the reality is, some have commented, you're not going to have a European-style government with our expenditures unless you have a European-style tax system to back it up and pay for it in some respects. And so that's where I think that where the value-added tax side of the equation comes in, because our government's moving in directions now of paying for more things, and it's very unsustainable, let alone at the state level, but at the federal level. And I think, again, that's why you're going to see more discussion rather than tax reform across the table that I think is needed. So you're just dealing with one simple page and filling out your taxes. It's probably going to get much more complicated down the road.
A question about the deficit and how we balance that. Someone asked the question here whether or not you would support cuts to the Pentagon in order to bring down the deficits. And I guess the broader question is, where does our defense budget fit into all of this?
Everything needs to be on the table, just like everything should be on the table for honest and fruitful discussion, without a doubt. For instance, when some defense programs were brought forward recently, I think it was the F-22, I said, can't do that right now, it doesn't make sense. And so it's not always just listening to certain lobbyists or industries that say, well, we've been doing this plane or this program for X number of years. We need to sort of figure out the balance. And I'm not an expert on some of these issues, but I have tried to use some of the resources I have to figure out, well, where should the priorities be? So the defense budget, and we have got real challenges right now. That's a whole other issue in terms of the wars that exist in Iraq and Afghanistan, and President Obama's recommitment, actually, to what President Bush had done in past years in terms of focusing now on that war on terror. I mean, those are budget expenditures that are also adding and compounding some of our challenges, without a doubt. And that's a whole other debate to have. But everything needs to sort of be on the table, essentially, if you're going to have an honest discussion about where should the priorities be.
Thank you. One question, and I'm not sure who asked this, and I don't know what this means, and if you don't, we'll ask the person, but you probably do. When will SBA limits rise from 1.5 million to 5 million?
Well, the Small Business Administration has certain limits that apply to loans that are offered in terms of guarantees, et cetera. And it's one of the ongoing discussions, and I'm not a member of the Small Business Committee, But when we had a hearing recently with the Small Business Committee and the Financial Service Committee that I serve on to talk about access to credit for smaller companies, and the regulators that we brought in that are squeezing banks because they go out and they meet with these banks and they're telling banks that, hey, I don't care if this is a performing loan and your customers never missed a payment. That doesn't matter. I think it's risky now. And so we're going to call it in and we're going to say you're not allowed to lend to these people anymore. That was the focus of our hearing. But the other issue was, what can we do ultimately through the Small Business Administration, or what should Congress be doing in terms of offering those guaranteed levels? So I cannot say that, oh, it's going to rise or go up, but that is something that has been brought forward, that it would actually provide some additional leniency or benefits to the difficulty in getting access to credit right now.
Question here, and go wherever you want with this one.
Uh-oh.
Congress regulates everything. Why don't they regulate themselves and lead by example?
Good question. You know, it's interesting that in the context of the broader debate when it was going on in terms of a public option as a part of the health care bill, should members of Congress be covered under the same health care bill that is going to be applied to the rest of the American public? And I was shocked that every time an amendment was brought forward, it was always defeated. I mean, politically, it just doesn't even make any sense. And I've always maintained that anything that's good for the American public should be good enough for members of Congress. Now, my understanding is that the bill that just passed, it doesn't have the same public option, obviously, but with these new exchanges that are put in place, members of Congress will also be required to go under the exchange pool or that program in 2014, I think, when it starts out, as well as staff. But there is one group that I understand has been left out, and that is leadership staff and committee staff. And those are the staff that wrote the bill. And those are the folks that really know the details of the legislative lingo and the language. And so I think there's something to ask here and look forward down the road. And I think, to be honest, this feeds into the arrogance of Washington. And I think that's why you saw somewhat phenomenal things happen, like the election of Scott Brown in Massachusetts, that no one ever would have imagined or expected. And I think there has been a wake-up call and a resurgence of people I know that call my office, because there is no issue that's more passionate or personal than health care, for instance. And you always get the groups that organize, hey, call your representative about X, Y, or Z. But on health care, people were calling night and day, and Luke and Dan will tell you this just on the volume of calls that came in, really concerned about how this was going to impact themselves as a company or as a family or as an individual, because it's such a personal issue. And there's real engagement by the population. I think that's a good thing. I think it's really a good thing. And you know, there's views on both sides. But the engagement by the public, I think, is really needed as people wake up to $1 trillion spending bill or some of the exhaustive spending patterns that have been happening of recent.